Hello, everyone. Welcome to the Igniting Hope podcast. I am stepping in as a visitor to the podcast room, and I'm just really glad to be here. My name is Ebony White, and I am the impact manager here at the Buffalo Center for Health Equity. But enough about me. I have a phenomenal guest that I believe all of you are going to be delighted to hear from and see and hear from again. Hi, Miss Erica.
Hi, Ebony.
How are you?
I'm wonderful. How are you?
So this is Miss Erica Rouse. She is with one of our leading mental health agencies in our community, Best Self.
That's right.
So she is the director of community engagement. Tell us, Erica, first about yourself and a little bit about what you do.
Sure. Again, my name is Erica Rouse. Grew up on the east side of Buffalo. Always loved helping people. Obviously being a black woman, growing up a little black girl, saw a lot of inequities and issues and challenges that we faced, the community, and myself, right? And I just always wanted to help people. I think that sometimes people just need that little push or that one little connection or that one little oomph to propel themselves or to better themselves. And I don't think it's ever that far away for people to just flourish and thrive. And so I love that I'm able to help connect others to what they need and what they want to move forward. I work for Best Self.
You work for Best Self.
Yes.
So we all know when we see that bright lime green, it's so vibrant, and it just seems to make you feel better.
It does.
Especially when we're addressing something as sensitive and has so much stigma as mental health.
Yes.
Talk about your role and what you bring to that organization, just kind of bringing that connectivity for our community at large.
Yeah, so I do a lot in the community. I maintain and or introduce new community partnerships and collaborations and excuse me, efforts to join and bridge gaps. I facilitate feedback sessions. Elevating voices is really, really important, and it's really a very, very integral part of my role. Mm-hmm. I have launched an ambassador program at Best Self. Okay. Yep, that allows those that don't have outreach experience to get that experience, to be out in the community, to talk, to educate others about mental health and what we do at Best Self. And for those who have the experience to perfect those skills, right? So we do that. I chair the Belonging Network, one of the Belonging Networks at Best Self. I do a lot of, representing Best Self in numerous spaces, whether it be fundraisers, galas, coalitions, and just really out there, building trust, sustaining relationships, creating relationships, and just I'm just out there. I'm outside, as they say. I'm outside. Yes. Mm-hmm. Yeah.
So I love the ambassador program that you're talking about. So who typically is a part of that program? So would it be a clinician that may not have any knowledge about doing the outreach, right? Uh-huh. So sometimes people believe like, hey, I'm a clinician or I built it, they will just come. And the truth of the matter is there's a lot of work that has to be done in building rapport and relationships.
That's right.
So who typically is a part of that ambassador program?
Whoever wants to be, if their role allows it, if their supervisor allows it. Okay. Anybody who's in good standing at Best Self can be a part of the ambassador program. Eventually, we will be working to branch out and make that like ambassador and a volunteer program for people that are outside of Best Self to come in and, help with outreach and spread awareness about mental health and those things. But yeah, anybody that wants to, because people want those skills. They just don't know how to go about getting them. And again, like you said, we're trying to center community engagement to where people are aware that there is a bridge between community engagement and clinical services, right? The community has to know that these services are available. So it's really important.
So there's so many ways we can go with this conversation.
Okay.
And I know that we had like
Let's
an
go.
outline, but we're gonna work through it. So you shared about the bridge.
Yes.
That you're doing a lot of bridging.
Yes.
So as it pertains to mental health and wellness and services for our community. Some people have engaged with services and it may not have been successful.
Yeah.
What would you possibly tell that person?
Don't give up. Okay. Don't give up. People don't know or don't even think to change providers. Like if your primary care is not giving you what you need, if they're not listening to you, if you don't feel heard, you don't feel seen, if you feel rushed, whatever the issue is, you can change your primary care provider. Mm-hmm. People don't even know that, right? Mm-hmm. And so it's the same with your mental health care provider. Your first time might not be great, unfortunately, you know? And so it's always important to revisit that with that provider and let them know. It's up to you. You want to give them another chance? That's fine. But you have the option to find somebody else, right? It is such an, like I said, unheard of thing, but it's real because this is your health we're talking about. Right. And if that person doesn't fit, you have the option to find someone else that meets your needs.
So that's amazing. So I want people to understand that you do have the freedom.
Yes.
Right? The autonomy.
It's your life.
So if it doesn't work for you with that current provider or counselor, you have the right to change.
That's right.
Right? Mm-hmm. But not give up on properly caring for yourself.
That's right.
And getting the care that you need. Many times we look at mental health as separate from our whole person. Mm-hmm. What are some of the things that you all do that has that inclusion, right? So although your specialty is in mental health, what are some of the ways that you also engage the community in different sectors? So whether it is heart health or whether it is just physical health, how do you keep that narrative of whole person? Mm-hmm. Right?
Well, we partner with a lot of different vendors and businesses in the area for fitness and, recreation and all those things, because it is one. Mm-hmm. Your health is your physical health, your mental health, your sexual health, all of those things. It's your health, right? We can't look at it as, one shouldn't take precedence over the other. It's all one. It's a holistic approach. And so we also have a lot of non-traditional ways that we meet the community, virtual services, drop-in hours, all those kind of things where you're not burdened to get services either, because that could play a part in your mental health, not being able to get there, right? Mm-hmm. And so I think we do a good job with that, the equity piece, creating access and bridging the physical health and the mental health by providing out of the box ways, to take care of your mental health, to prioritize self-care.
Right.
Yeah.
And taking care of your mental health, your physical health, your sexual health, your spiritual health.
Yes, right? Of course.
It's all
yes, absolutely.
And recognize that, and that's huge for people because often we've had to kind of separate it and silo it.
Absolutely.
How many locations do you all have?
Oh, we have over 30 locations, Best Self, throughout Western New York. Wow. We have a lot of clinics throughout the region. So yes, it's over 30.
That's amazing.
Yes. We outside. We are outside. Yep. Uh-huh.
So we're gonna make a quick segue.
Sure.
To our partnership.
Yes.
So we want to talk about the triad.
Yes.
Right?
Yes.
With Buffalo Center for Health Equity.
Yep.
Best Self.
Yep.
And the Office of Health Equity.
Mm-hmm. The inaugural Erie County Office of Health Equity.
Office of
Yes.
Tell our viewers a little about what we've been working on
Sure.
and what to expect.
Sure. We are um we're together. As I stated earlier, it's like full circle for me. Now being at Best Self, coming from the inaugural Office of Health Equity, it just really came full circle. So it's an honor to be working with you all. Yet again, we.
No, wait a minute. Don't confuse the people.
Oh no. Okay, I meant. Okay, I'm
so,
sorry.
so
When I say you all, I meant everyone.
everybody.
But
Okay.
yes,
Okay.
yes, yes.
Okay.
But the Office of Health Equity
Okay.
and the Buffalo Center for Health
Okay.
Equity are two different entities.
We are.
Anyway, and that clarification is important. It is. So we've all come together to study the mental health of youth in the city of Buffalo,
Okay.
which is a powerful, powerful, powerful movement. I would say it's a movement. I am honored to be a part of this pilot. The intended group that we will be looking at for this phase is 5th through 8th graders. We've partnered with Say Yes. We've partnered with CCNY, which is Community Connections of New York. And we've partnered with a number of charter schools and Buffalo Public Schools to a certain extent in the area. We're prioritizing the east side for now. Obviously, we're going to branch out, and no child is excluded out of this, but just prioritizing the east side schools in that area. And we're gonna be out there. We're going to be listening to the youth. So many times their voices are just shushed.
Yeah.
And we're gonna give them a chance to talk about what their needs are. We're gonna give their parents and their families and caregivers a chance to talk about what their needs are and what they feel the youth's needs are, right? And we're gonna talk to staff. We're gonna talk to support staff in the schools and different programs and see what's going on. And the end of the project, we will be able to make recommendations to provide better access to care for families in the city of Buffalo.
That's amazing work. I'm, even being a part of it.
Yes.
It's amazing.
Yes.
So we already know, and I really agree with centering those voices that we're always trying to figure out what to do with them.
Yes.
Versus how they would like us.
Sometimes they're already telling us, and we're not listening.
We don't listen.
Yep, we're not listening.
So the fact that we are intentionally starting from scratch, because Best Self is already in many of our schools.
Yes.
Providing support.
That's correct.
Which is amazing.
Yep.
And we've had the ability to kind of look at some of the data as it is today. But I think it's always very important that data is coupled with real life experience.
Qualitative data, just as important.
These are names.
That's right.
Numbers are fine, but I want to hear their voices. I want to see their faces, because that's where that real exchange happens.
That's right.
For us. So one of the things that we've learned during our work thus far, coalition work, and it wasn't hard to start. Honestly,
no,
because
we are 3 powerhouse agencies,
right.
Great people, lots of connections, so many things that each of us bring to the table. Right. It is like, when I'm not being phony, like it is like family. When we meet, we love on each other, we support each other, we hear each other out. We disagree
about some things,
but in the end, it's all love, and we get to a solution, and that's that. We eat good food.
We do.
It's just been wonderful. It's been wonderful.
So the fact that we talked about eating, so what we know is, so we have an event coming up.
Yes.
That we really want you to be there.
Yes, we do.
So a lot of our work is because we've already went through the hard part, getting to know each other, right? As agency to agency, what our strengths are, what our weaknesses are. But guess what? We strengthen those weak spots together collectively, because we have the overall intentionality and goal to give the very best to our community. And we're not outside of our community.
Right.
Like, I'm talking about myself. I'm not
Yep.
othering
That's right.
anybody.
That's right.
I'm talking about myself. I'm
That's
talking about
right.
my cousins. I'm talking about
That's
aunties,
right.
everybody.
That's right.
Um, so we have an event coming up that I'm excited about.
Yes.
I'm super excited about. So can you
Yes.
share with the viewers
Yes.
if
So
they have not already seen
if you
it?
haven't already seen it, we are having a holiday dinner. It's a community holiday dinner and giveaway. Um, Many think it's a toy giveaway. It's not particularly a toy giveaway.
Mm-hmm.
We're focusing on the needs of families. It may be personal item needs, feminine hygiene, deodorant, soap, those kind of things. It may be Clorox. It may be whatever you may need for your house. We're giving away produce bags. We're giving away small gifts for children. And we are having a beautiful dinner that will be catered by Chef Rob Thomas.
Nice.
It's going to be so beautiful. We're going to have music. Kente Claus. I gotta forget about Kente Claus. Kente Claus is going to be there. Squiggly face art and face painting is going to be there. It is going to be amazing. It's going to be at Buffalo United Charter School. Shout out to them. Shout out to Dame Franklin, who is so amazing.
She is.
They're one of our
Phenomenal.
partners as well.
Yes.
For the pilot. And I'm so excited. And this is going to be a huge event. I have heard many families express their gratitude already for what they just expect to happen,
Mm-hmm.
and so it's really just about community, about supporting each other in these trying times. We're going to talk a little bit about the triad,
Mm-hmm.
give folks a chance to hear about that. And we're just going to have a good time and we're just going to just enjoy each other. It's going to be very, very
I'm
nice.
excited.
And I cannot wait to see everybody.
I am. I'm excited.
Yeah.
If you have not already registered, you can actually go to either of our organization's pages.
Yeah.
And find out more and how you can register for this event. If you have not registered, please go to buffalohealthequity.org and you can find out more information and you can go directly to the flyer or you can register at bestselfwesternnewyork.org as well for that event. That is December 16th at Buffalo United Charter School, and that is going to be from 6 to 9
Yes.
p.m.
Yep.
So we want you to get there a little early because we want to talk to you. We don't just want to feed you, we want to talk to you and make sure that we are on track for what we desire to do with you and for you. We're building something beautiful,
Yes.
right? This is the architecture of building community.
Yes.
And most of the time, it starts culturally with a conversation with our children, a conversation with our adults. And Erica, you shared that you've already had the chance to talk to some of the adults and hear what some of the needs are.
Mm-hmm.
There's no shame.
Right.
This
None.
is all with humility.
That's right.
Right. So we are here to serve.
Yes.
Right? We are serving with our heart, our intellect,
Yes.
and our professionalism, and
Yes.
our organizations are standing alongside us and with us to do this work. Are there any final thoughts you want people to know about as we prepare for the holiday season and your mental wellness? Like, this season sometimes can create grief and loss and all of those feelings. Letting them know that the resources are available to them.
Yeah, for sure. It's natural. You log on to social media or you walk down the street and you see all the Christmas stuff or the holiday stuff or whatever, Kwanzaa, whatever you celebrate. You see all of these things, right? And no matter what the occasion is, or no matter what the method of celebration is, that might not be your feeling. You might not want to see decorations. Decorations may remind you of somebody you lost. It might remind you of a bad time that you had in your life. And that's okay. That's okay. And Best Self is here for you, providing that mental health support. Go right on our site, type it right in, Best Self. It'll come right up. We service anyone. And we understand that these times are rough. No matter what you say, whatever you see, everybody's joyous and having these smiles and the songs, but that's not what you feel inside, and that is valid. Your feelings are valid, and people should be sensitive to that. But a lot of times we do get caught up in the season and things, but it's okay. It's perfectly normal, and help is here. So yes, help is here.
Amazing.
Yeah.
So help is here.
Mm-hmm.
And if anyone needs to talk to someone immediately, there is always our hotline, a hotline for you, which is 716-834-3131. If you feel like you are in crisis, that is available to you 24/7, 365. And for those of you who would like to join us and be with us on December the 17th from 6 to 9 at Buffalo United Charter School, register. We look forward to seeing you all and learning from you all. But until next time, thank you again, Miss Erica Rouse.
Thanks for having me, Miss Ebony White.
I appreciate you. And Igniting Hope Podcast, Ebony White signing out. Bye now.